right. We're live. Okay. Good day, everyone. Permit me to say Happy New Year. Yes, Happy New Year, because this is the first time the Insight webinar audience is meeting in the year 2025. The last time we had edition of Insight webinar, it was the year 2024. So I'd like to welcome you to the 20th episode of Insight webinar, the first in this year 2025. And if you're joining us for the first time, Insight webinar is a series hosted by eHealth Africa. And this series brings together public health professionals to discuss critical issues and explore ways to enhance healthcare delivery. My name is TJ Sojumu, and I'll be your moderator for today's discussion. So let's get started. Now, I'm going to just go through a quick background of today's discussion. A 2023 report from the United Nations International Children's Emergency Fund, UNICEF, reveals a troubling global trend, a decline in public trust in the importance of vaccines. Now, this shift has led to stagnant childhood immunization rates, leaving an additional 2.7 million children either unvaccinated or undervaccinated. Now, the number of children who missed their first dose of a vaccine has risen from 13.9 million in 2022 to 14.5 million in 2023. Alarmingly, nearly 3 out of 4 infants now live in countries with insufficient vaccine coverage. This growing gap is believed to be a significant driver of recent measles outbreaks and poses a serious challenge to achieving the 2030 immunization targets. So in response to this urgent issue, this episode of Insights webinar will focus on bridging vaccine gaps to meet the 2030 immunization target, with particular emphasis on the challenges faced by developing countries. Today's panelists are leaders in vaccine delivery and immunization, and they have spent years working to ensure no child is left behind. I'm going to introduce our panelists in no particular order. But before I do that, I want to welcome anyone who is just joining us, and I want to tell you to share this link to your friends, professionals in the field of health, your colleagues. Let them know that Insight webinar is live. If there's anyone you know should be a part of this conversation, please send the link to them. All right, so the first guest or panelist I'll be introducing is Dr. Sheikh Kabir. Dr. Sheikh is the health manager immunization for UNICEF country office in Abuja. Dr. Sheikh is an immunization professional with a background in medicine and a master's degree in epidemiology. He has been working in the World Health Organization and UNICEF in multiple country programs, focusing on strategic planning, operationalization, monitoring and evaluation of routine and supplementary immunization activities since 2002. He has extensive experiences in the strategic and management aspects of the immunization system strengthening, such as immunization supply chain and vaccine management in multiple countries. Dr. Sheikh, could you unmute your mic and say hello to our listeners this afternoon?
Hello, everyone. Good to be with you today.
Thank you for being here, Dr. Sheikh. All right, the next person I'll be introducing is Dr. Peve P. Stokwase. Dr. Peve is the coordinator infection protection and control, or some people call it infection prevention and control, at the EHA clinic. Dr. Peve started her practice with the Nigerian Army. She worked as an emergency responder with the German Technical Advisory Group, GTAG, in Nigeria. She has committed to many outreaches across the country, rendering aid and healthcare services to indigent individuals. She has certifications in healthcare leadership and management, clinical research, coordination, and global health. Dr. Peve, could you please unmute your mic and say hello to the audience this afternoon?
Hello, everyone, and welcome.
All right, thank you, Dr. Peve, for being with us. All right, and last but not the least is Mr. Muhammed Faosy-Adeniran. Mr. Faosy is the project manager, vaccine direct delivery with eHealth Africa. Mr. Faosy is a supply chain management and project management professional with over a decade of experience in health and humanitarian supply chain management, as well as public health emergency response projects. He has worked across 4 African countries. Currently, he manages 8 projects at eHealth Africa, including the Vaccine Direct Delivery Project, which ensures the availability of vaccines at last mile cold chain equipped health facilities. He also oversees the engagement of traditional institutions project in collaboration with implementing partners such as Solina, Chigari Foundation, the Sultan Foundation for Peace and Development, and some other partners. And this project addresses issues of non-compliance and vaccine hesitancy within communities. We're glad to have you here, Mr. Mohammed Faosy. Could you please unmute your mic and say hello to our viewers?
Good afternoon, everyone. Good morning from wherever you're joining us from. Thank you for joining us.
Thank you very much, Faosy. All right, so we have a quick, interesting video. So our team went on the street to ask a few Nigerians questions around immunization and what we can do better. As we go on this break now, we'll just show you that video and then we'll come back and dive into the questions. Please don't go anywhere. All right, IT, help us.
Meeting 2030 Immunization Target. Voice from the streets.
Okay, I think what makes people feel uncomfortable taking vaccine, one is because of fear.
Most of them believe vaccination is not good for their children. They believe in local medicine that they take, and some people is ignorance.
To my own understanding, most of these are, especially most of the old ones, and these children they are just going because they don't know about vaccine. Maybe due to what they heard from people that have not been vaccinated before. To me, I've been vaccinated before, and it is very important.
For us to make them feel comfortable, we have to enlighten them, we have to educate them on the importance of vaccine in the lives of our children.
Printing out bills, get vaccinated.
Like me, I do advise people to please get vaccinated. It's very good for you, your children. It's very good. It's okay. Everybody should try and be vaccinated.
I think number one, language is very, very important. When you use the language I understand, go and get vaccinated. You use my own language to communicate with me, I will understand.
I think the best way to reach out to people who haven't got vaccinated is going from school to schools, maybe market, business place, to educate them about how it's very important to get vaccinated. And this is a month of cervical cancer, right? And it's good for our upcoming girls, young girls, to go and get vaccinated to avoid being affected by cancer.
All right, welcome back. If you are just joining in, welcome to the 28th episode of Insight webinar. Today we're talking about the immunization agenda 2030 and how to bridge the gap, the current gap that we have. The video you just saw is the voice of people on the streets, and you can tell that there are diverse beliefs as touching vaccine safety, and this is one of the things responsible for acceptance of vaccines, hesitancy, and I'm hoping that as we engage with the panelists today, we're able to shed light on some of the challenges and also bring possibly solutions that stakeholders, decision makers on this call can hear and probably take to their different workplaces and organizations. And from there, we're hopeful to see change. All right, so the first question goes to all the panelists, and this is it. The Immunization Agenda 2030. This is the global strategy to leave no one behind by 2030. So how realistic is it to achieve this Agenda 2030 goal of universal vaccination coverage? How realistic is it? So maybe Dr. Peve, I'd like you to, open the floor. So from your perspective, how realistic is it for us to achieve this 2030 agenda, universal vaccination coverage?
Okay, thank you so much, Tijisu, for the question. 2030 as part of the agenda to try and see if we get everyone vaccinated by then is a bit of far-fetched, especially if you're in the field of medicine, if you're in the field itself, and you get to understand that there is a decrease in the reception to vaccines, especially after the COVID-19 stretch we just experienced, because people had side effects and people had a very bad reception towards it. So there definitely, in fact, even the World Health believes that it is an overreaching goal to actually get it by 2030. But if we can get a significant amount or a change in the values and the data currently from the drop from 14 point, I think 1 to about 13.9 that we are having now being accepted, I think maybe we might be able to get some headway. But sincerely, it's very difficult at this time to actually get that. It's not just a problem of both those who are not educated, but it's a problem with even the educated folks and those who aren't educated. So I think it's a far-fetched. That's it for me. But I'm not being pessimistic. Optimistically, we hope we get there. At least we get a significant interest towards getting vaccinated. Thank you.
All right, thank you very much, Dr. Peve. Dr. Sheikh, Dr. Peve thinks it's far-fetched. What do you think?
Thank you very much, Tijisu, for asking me this question. And once again, thank you very much for allowing me to participate in this webinar.
You're welcome.
I want to be optimistic about the Immunization Agenda 2030. I want to reiterate what you have said in the opening or introduction of this webinar today, as well as the people who were interviewed in the video we saw. I'm surprised to hear I mean, some of the strategic priorities and principles that were set in the Immunization Agenda 2030 were spoken by those people, actually. So you already mentioned that more than 13 million children are remaining zero dose each year. And however, we are also vaccinating more than 116 million children every year. So the unrest or unvaccinated or partially vaccinated numbers are still quite high, but I believe it is not impossible. I can see my internet is showing signal. Please confirm you are hearing me. So I
Yes.
believe that it's difficult, but it's not impossible. We have examples of eradicating wild polio virus even from Nigeria. We still have some circulating vaccine-derived or circulating polio virus variant, but we have eradicated even from Nigeria despite its low immunization coverage. We have fought against the COVID-19. We have eradicated other diseases. We have controlled measles to a controllable level, and in many countries have also eliminated neonatal tetanus, etc. So it's possible, I believe, and especially if we look at the goals, strategic priorities, and core principles set in the Immunization Agenda 2030, I think it's quite it seems still realistic, especially when the goals are increasing equitable access, strengthening immunization with primary health systems. So immunization is
Okay,
a key
Dr.
point.
Sheikh, I think your network signal
So
strength has reduced,
yeah,
and
so
can
please
barely hear
confirm
you.
if you
But I
can
think
hear
I
me.
understand.
Let me turn off my camera so that if it improves.
Okay, okay,
Okay, so the
okay. I think that works.
strategic priorities and core principles appears that it is still possible, especially when the priorities are coverage and equity, demand creation, life course vaccination and integration, outbreak responses, and improving immunization supply chain, and most importantly, research and innovation in the immunization program. And the principles if we look at it, these are people-centered, country-owned, partnership-based, and of course, data and research guided. So having said that, I believe that though it's challenging, but it's still possible, at least for many of the countries. Thank you.
All right. Thank you very much, Dr. Sheikh. Mr. Muhammad Faosy, Dr. Pefe has said it's a stretch, a bit, tough ambition. Dr. Sheikh says it's difficult, but not impossible. So from your own perspective, what do you think about the 2030 immunization target?
Thank you very much to Jesu for that. And thank you, Dr. Sheikh and Dr. Peve, for painting the picture that it's possible. And I actually align with them. And I feel the realism comes from having understood that we've had other strategies implemented in the past. We had the Global Vaccine Action Plan that was implemented between 2011 to 2020. And if we look at the Vaccine Action Plan, the GVAP, we'll be able to look at what was learned during that period. What are the mistakes that were made and how can we improve? Also looking at the backdrop of COVID-19. I know COVID-19 brought up a lot of issues, especially around vaccine hesitancy and all that. But leveraging on the lessons from this from the pandemic and the strategies that was implemented previously, I think the whole system can benefit from it and further guarantees the realism of achieving the IA 2030. For me, I think what they need to look at is, provided there's adequate funding and the political will, then you integrate the health system strengthening together with the primary health care, right? Then technology is advancing. You have AI, you have machine learning. When you bring all those in, it will be realistic to achieve this. It might not be the high 100%, but at least we'll be able to get to, say, 90-something%. I guess what I'm trying to say in summary will be aligning the strategies with the universal coverage would actually help. And what would really be the underpinning strategy will be leveraging on the lessons learned from the previous one and significantly work towards progress and leaving no one behind. It's quite feasible with good effort and concerted effort. Thank you.
Thank you very much, Mohammed Faosy. I've heard you say, adequate funding is critical, political will, system strengthening, leveraging lessons learned on each cycle of vaccination. Thank you very much for sharing your thoughts. If you're just joining us, I'd like to welcome you again to the first edition of Insights webinar in the year 2025. And today we are discussing how to bridge the vaccination gap, in trying to achieve the 2030 immunization goal. So please, if you have questions as we'll go further, please put your questions in the Q&A box and we'll take your questions, at the end of our conversations with the panelists. So I'm coming back to you again, Faosy. eHealth Africa delivered over 5 million vaccines across Sokoto State just last year, 2024. But according to data, only over 1 million were vaccinated. eHealth Africa, I'll take that again. eHealth Africa delivered over 5 million vaccines across Sokoto State in 2024, but only over 1 million children were vaccinated. Could you please explain why do we have this gap?
Thank you very much. And I'm happy you asked that question because you actually makes it interesting that a lot of people do not really understand that the number of doses is different from the number of children immunized. So to be specific, actually, the number of children reported immunized from these health facilities was 1.9 million children. But there are several factors that can lead to this, right? We do the last mile delivery. However, there are things that are called multi-dose requirements, right? When we're doing these deliveries, it will be vaccines, BCG, the rotavirus, and all those other vaccines. But when a child goes to the health facility, if he gets immunized for BCG, Penta, and all that, that's one child. So you wouldn't just think he's got 5 million doses will go to 5 million children. No, because they are bundled together and they are delivered within the health facility. When a child comes, he receives multiple doses. So that actually contributes. So let's say, for example, approximately 5 doses per child. So that is the standard when it comes to immunization schedule. Then other factors like vaccine wastage. Sokoto State, the good part is since we started the delivery, Sokoto State got an award as one of the states with the lowest stock-out rate. And that credit goes to both eHealth and partners and the state themselves, the state primary healthcare, because they are intentional about helping their community or their state. So there's the wastage aspect will be open vial wastage. If you open a vaccine, one vaccine vial is supposed to immunize, say, 10 children, right? But you wouldn't say you must have 10 children at the health facility before you open one vial. So in the event that you open one vial and children are not available, you only immunize the one that is there. And when the mother leaves or the child leaves and that stays out for a while, it's no longer usable. So the potency is no longer there. So you will not advise that they immunize another child with something that is not potent. There are other issues like cold chain failures, but that's something that we've been able to reduce to the barest minimum. When that happens, vaccines get evacuated and moved to the nearest LGA cold store. So that has helped. We also have maybe health workers playing a role here. Sometimes reporting when it comes to data. So they might not report all the number of children vaccinated within Sokoto State. And if they don't report that, there's no way you can get it because there's no end-to-end visibility within the state. We have the visibility of what we take from the state cold store to the cold chain health facility, but the reporting mechanism is still pretty manual. And you have to follow up with the state people to be able to get the reporting in place. This has improved too. They've done tremendously well. And that's why you can see that they got the award for the state with the lowest stock out last year. Vaccine hesitancy plays its role. We all know what happened. Misinformation, religious and cultural beliefs also play a major role in this. Overall, I think what I would just say is there's been improvement. Sokoto State used to rank among the states with the highest zero-dose children. And this is not a problem of one person. It's a collective problem whereby you need to look at the poverty, the insecurity, and the entire health system capacity building. I think I would stop at this, but those are the few issues bedeviling or what could lead to the gaps you're seeing in the number of doses delivered and number of children immunized. Thank you. Yeah.
All right. Thank you very much, Mr. Muhammad. And that's a very clear explanation. I think that for everyone listening, I think whenever you see such reporting that 5 million vaccines and then maybe 1 million or 2 million children vaccinated, you're able to make the correlation that 5 million vaccines does not automatically translate to 5 million children vaccinated. And just like he explained, there are multi-dose vaccines, there's vial wastage, there might be challenges with reporting, and some other things. Thank you very much, Mr. Muhammad Faosy, for that explanation. The next question goes to Dr. Sheikh. Dr. Sheikh, what lessons can be learned from past immunization campaigns that can help accelerate progress towards the 2030 immunization agenda? What lessons can we learn from past immunization campaigns, from your experience?
Thank you, Tijesu. That is indeed a very important question, especially in the Nigerian context, because we all know that Nigeria every year we conduct many campaigns, either planned campaigns or even campaigns to respond to the outbreaks. Especially in 2023, 2024, we have seen planned campaigns of measles or measles follow-up campaigns, TD vaccine campaigns or MNT campaigns. We have seen outbreak response campaigns such as for diphtheria. We have seen Mpox vaccination drive and efforts. We have seen meningitis vaccination, etc. So there are many campaigns, and considering the current vaccination status, we can anticipate that Nigeria will continue to face many other outbreaks, as well as due to its low routine immunization coverage, especially measles coverage. Measles follow-up campaign will recur. Also, we have vaccine introduction campaigns such as HPV, and there is a planned MR campaign in 2025 and 2026. So another new vaccines, rubella vaccines will be added, but along with the measles. So we have lots of lessons learned from the previous campaigns, especially since the COVID-19. And some of the lessons we have learned from there is, I don't know, like my internet is again unstable, but if you can still hear me, I would like to mention some of the lessons we have learned from Nigerian campaigns are the integration. So states are busy with so many campaigns one after another. So an integration could be a good options, and could be a good lessons learned to be introduced in future, so that it's planned well ahead and they are integrated, so that they cause minimal campaign fatigue to the health workers or health workforce, so that they can concentrate on the routine immunization for the rest of the time. Then another one is we have chronically missed communities and children. So one other lessons learned is the identification, enumeration, and vaccination of the children, such as updating the master listing, using digital technology to prepare the digital microplan, etc., as well as the master list. Conducting campaigns with social orientation, especially the children are targeted in the campaign. Reducing distance of travel for the caregivers to the vaccination post, meaning that replan the temporary fixed post for the campaigns which are injectable. Polio, we know that they are house to house, but plan the session closer, close proximity to the community. And then inclusion of traditional leaders, community leaders in the vaccination teams, as well as the ACSM component, as well as for the ACSM component or demand generation activity and community engagement activity. Timely channeling of funding, resources, logistics, etc. These are some of the lessons learned. We also have seen that there are growing tendency of data falsification, fake finger marking, etc. in some communities or in some geographical areas. So innovations and social measures to be incorporated in future campaign to avoid the data falsification and the what is it called, the fake finger marking, etc. So those are some of the quick points I can mention here as the
All right.
lessons from the campaign. Thank you.
All right. Thank you, Dr. Sheikh. It's quite, a bit challenging for people to hear you clearly, but I believe we're able to get, the crux of what you're talking about. I mean, from my notes, I can see you spoke about the importance of integration as a learning point, identification, enumeration, and vaccination. Updating the master list, pre-plan for campaigns, which is something that eHealth Africa, helps other states do. Inclusion of traditional leaders and community leaders, which is something we currently do. Timely channeling of funding and resources, and innovation to be incorporated to avoid data falsification. Thank you very much, Dr. Sheikh, for those points. All right, so my next question goes to Dr. Peve. What are the most common barriers you encounter in ensuring children and adults are up to date with their vaccinations? How can these gaps be effectively identified and addressed? Dr. Peve.
Thank you once again, Tijesu. One of the common barriers you face is continuity or reportage, or even keeping a track record of these vaccines. So just like Mr. Faosy had earlier said, there might be multi-dose vaccines. There are vaccines that either do their multi-dose, or patients have to have continuous reception of these vaccines. And as a result of that, sometimes people take the first dose and then they are done with it. And just as we have earlier said, there are so many myths that people have with taking vaccines. Oh, if I get the vaccine, I'm going to have this problem, and it's going to cause me this sickness. My child will not grow properly, or they won't grow to a certain height, or it will cause some certain complications. Or with the recent wokeness, the West is trying to inject some things into my body so that they can control the narrative and all of that. So yes, the barriers we face is they are on different levels. They have a multi-level issue. So in the community wise, in the villages and in the rural areas, you have people not, first of all, having issues with language barriers, especially if the people going in to give these vaccines are not indigent to those environments. So people are more receptive to people from their environment than to visitors coming from outside to give them these vaccines. And there is this thing again we have in the communities where there is like a tax thing. So you want to bring some form of care to the community, and the village chiefs or the village heads will request that, oh, we need some certain amounts of monies that would allow you to have access to our people. And you see, this causes a barrier to actually getting people vaccinated, because how many communities are you going to pay people to offer aid to them? And when you do this, automatically you are actually making them believe that truly, yes, there is something about this thing. I'm trying to help you, but you feel like I should give you some form of expense. And then when we come on the higher level, we have people who will tell you time management, or they can't keep records. This keeping of records comes from both sides, both from the healthcare provider and also from the recipient of these vaccines. So you say, okay, your next vaccine is maybe 2 weeks, or in 3 weeks, or 4 weeks, as the case might be. And the patient is saying, okay, no problem. So we don't have maybe proper recording of their next appointments, their next bookings for their vaccination. And even when it is time, maybe they are not available, or the availability of the vaccine at the time when it is actually going to be needed. Another thing is the over-educated. So people who are overly educated and have access to a lot of information actually have a lot of pros and cons. And the human mind is built that most times you take the cons instead of trying to see how much the pros will be of benefits to you. And so people have this, oh, it's going to do this to me, I might have this side effect. And most times we try to allay their worries and make them understand that this is not much of a problem. It is the benefits outweigh the negativities. But most times it's a very difficult thing to get through to people. I normally would tell people it is easier to actually work with, because most times the educated folks have more resistance to having to continue these vaccinations as compared to the vaccine. And if I cannot afford to take care of my health care, I know that the best thing for me to do is to prevent it. So basically, I think one is the methods that with which it is being given. So if we have patients, another barrier I think is we're having less advertisement for immunization. I remember growing up as a kid, there used to be a lot of adverts about the importance of getting vaccinated and all of that. And so it was a parent thing that made parents want their kids to be vaccinated. Another thing is also reducing costs. So some vaccines actually come at a cost. And sometimes because they come at certain costs that might be very difficult, it might be very difficult for patients to be able to get those vaccines as at when due. Another thing, it could be linking vaccination to women and infant services. So one of the best ways to get vaccinations across or immunization across board is most times linking it to women and children activities. That way you get people to be more interested in the vaccination. But most times these days, with the services that are being provided for women and children, vaccination is not really taking a very key role. Like I said, it still goes back to education and advertisement and trying to enlighten the people again about it. So I think maybe with this, it gives us an idea of the barriers we're experiencing currently with the vaccine. Thank you.
All right, thank you very much, Dr. Peve. So much to say, so little time, but thank you for identifying, some of these challenges. One of the things that you mentioned that really caught my attention, and I believe everyone in Nigeria has, heard a similar story or probably experienced it, is the issue of tax. When you want to go into a community to do something for them, either the leaders or maybe the youth leaders, they want you to pay them or give, some sort of incentives. This is a common happening around Nigeria, and I can only imagine the challenge that will pose for health organizations. Thank you for sharing all that you've shared. And something else also too is the issue of advertisement. When you spoke about that, I could only think of how people have also moved, largely from television to social media, and the role of digital channels in bringing immunization information to people. But I mean, that's a conversation for another time. If you are just joining us or you joined some minutes ago, you're welcome again to Insights webinar. This is the first edition in 2025 and the 28th edition in this series. Please, you can put your questions in the Q&A box, and very soon we'll be giving your questions to the panelists. So please type your questions in the Q&A box. All right, so my next question goes to Dr. Sheikh, and I'm hoping we can deal this in like 2 minutes or 3 tops. Dr. Sheikh, what are the key strategies to improve vaccine demands, especially in underserved communities?
Okay, thank you very much, Tejasu. I hope you can hear me right now.
Oh, yes, I can hear you.
Okay, yeah, thanks for raising quite an important immunization important areas regarding Nigerian immunization program. So, how to improve the demands, especially in the underserved community. During the campaigns as well as the routine immunization programs, this is something, or we have been facing so many challenges in these areas actually. How to improve the demand, because you mentioned that the 5 million doses were made available in Sokoto and Zamfara. Only 1 million children were vaccinated. Clearly, there might have been demand issue along with other access challenges. So the same question is now being asked that okay, every year Nigeria is procuring $100 million vaccine doses, while our penta-3 coverage is still 53%. Then where are those vaccines going? Clearly, there are issues of demand remaining in the community. So to improve the demand, we also heard from the from the video, from those who spoke on the video. They're saying, come and speak my language, come and explain the benefits, etc. So clearly, we have to, or Nigeria or elsewhere in the world, the community engagement and trust building is the cornerstone of the immunization program, like many other public health programs. So we need trusted local leaders. We need to engage trusted local leaders, religious leaders, community leaders, and other grassroots organizations, and engage them to disseminate the accurate information to the communities. We know refusals, block refusals uh, from the community. So clearly, we have to be very innovative. So we also have to leverage the community health workers. So we know the examples of polio. We had BCM, we had other community health networks. So we have to uh, make this program nationwide so that there are community health workers who are part of that specific community. We are sending a vaccinator or a CHIU from the health facilities, going in the morning and coming back in the afternoon. But who is owning and facilitating or moderating this from the community? So we need community health workers and bring them perhaps under the payroll or any kind of incentivization. Involve the community members in decision making as well. And then one big issue is misinformation and vaccine hesitancy. So we have seen this during COVID-19. We are still facing it for polio vaccination. We have faced it during HPV vaccine rollout. So misinformation, anti-vax propaganda, even television channels, even pastors or religious leaders were talking against the vaccines. So we have to address the misinformation and vaccine hesitancy. We have to use multiple communication channels, the local language, the radio, the social media. Especially, we have to monitor the social media, track the social media trends. We have to follow the trends in the social media and then address. We have to counter them. And then the door-to-door outreach approach. We have to improve the access or take the benefit of the access, convenience, etc. We have to build the confidence in the health to the healthcare system, to the community. And also, we have to have different and tailored approaches for specific target groups. The specific, I mean, the approach for the urban elites may not work for the slums, and vice versa. So those are, and then urban versus rural. So those are some of the points I can mention to improve the community, the demand in the community. Over.
Community. Right. Thank you very much, Dr. Sheikh. So the next two questions I'm going to ask Faosy and Dr. Pether, I would appreciate if we can answer them very quickly so that we can, take questions from the audience. I can see a lot of questions are getting into our Q&A box, and I really want us to be able to answer their questions. So just quickly, Faosy, while Dr. Sheikh was speaking about strategies to improve vaccine demand, he spoke about trust. So from your own perspective, what role does community trust and vaccine confidence play in closing vaccination gaps, and how can trust be rebuilt? Quickly, give us your thoughts.
Thank you very much, Tejas, for that. And thank you, Dr. Sheikh, for mentioning that. The truth is, when you're talking about trust, there's that need for the community to trust and have confidence in vaccine. And that's the basic foundational approach to closing the vaccination gap. When they don't trust it, how do you influence them to go and take vaccines? How do you get families or individuals to go and accept vaccine? Even when vaccines are physically available, logistical improvements have been made. If people don't trust it, they would not go. So the best approach is you have to build confidence. ensure that you invest in building confidence, ensure you engage the right people to educate these people about the vaccines. Make sure they are locals. There are other approaches. You can go through the media, all the community-based organizations within the community. Make sure the adverts or the radio jingles you're pushing out are in their local language. Once they are in their local language, they can relate to it. Also, let them know the content of what they are taking. Once they have that, then vaccine confidence can be restored. There's one key thing that people don't know. There's what they call herd immunity, whereby if 95% of the population is vaccinated, automatically the disease either gets eliminated or somehow if anyone gets it, it's controlled because it won't be able to spread the way it spreads. If people have trust in this, herd immunity will be in place automatically. We can also look at equity. You know, when there's crisis, there is insecurity, people are marginalized. You have to find a way to get to these people to make them know that they are still cared for, right? There's a lot to do, but because you said there's no time, I wouldn't want to really take too much time to explain on other things like crisis resilience, factors that contribute to that. But yeah, I'll leave it at that so that you can move on to the next question. Thank you very much.
Thank you very much, Pastor. Thank you very much. So quickly, Dr. Peace, when you were answering the last question about barriers to vaccination, you had mentioned things like misinformation about the vaccine, and you also spoke largely, about overly educated people. So now my question to you is this, and I hope you can answer it as briefly as possible. What strategies have you found most effective in educating patients and families about the importance of immunization? Dr. Peva. Dr. Peva, can you hear me?
Okay, I'm on the call, but I think you're breaking up on your end, so I'm getting a bit. Yes, I can hear you.
Okay, did you hear the question?
Hello, can you hear me? Yes,
Dr.
you said
Peva,
something about overly educated people. I think that was the bit I heard before you.
oh, okay. So I'm asking, what
Hello.
strategies have you found? Okay, so I want to ask the question now. So what strategies have you found most effective in educating patients and families about the importance of immunization?
Just like Mr. Faosy already said, it is just meeting them where it is convenient for them. So people like to feel good, and it's how you make people feel that makes them more receptive to whatever you give to. So it's more of making them understand from your own point of view and having to consider their difficulties or what their fears are and trying to allay it. And as much as possible, speaking to them in a language they best understand, giving them examples or samples of people in their environment who are well respected and have gone through this vaccination and seeing how effective it is for them. So yes, basically it's just education, making sure our primary healthcare centers are well equipped and properly suited for giving vaccinations so that people feel they're receiving quality at all times, both whether they are in a very high-end community or not. And I think the reception will be much better.
All right, thank you very much. So we're just going to jump into the Q&A session. And I'd like you to promise me that, we can keep our our answers within 2 minutes so we can take as much questions as possible. So I'm going to put the first question to Faosy, saying that you work with eHealth Africa and you know how we use a lot of digital tools to bring health solutions to people in underserved communities. So this question is from Mr. George Uduku, and he's saying, what role does digital health and data analytics play in improving vaccine delivery, tracking coverage, and identifying populations at risk of missing immunization?
I would have to go back. Let me see. George, I love your question, and I would say technology plays a very vital role, right? And if you really want to get to more people, ensure that there's proper record for you to make informed decision, you need to ensure technology is the underpinning strategy you would use. Say, for example, when we want to map out mixed population, we use the GIS technology. With the GIS, that's Geographical Information System Technology. With the GIS, you can map out communities, settlements that have been missed, and all that. This plays a major role in ensuring that technology is leveraged to get to more people. Then you talk about mobile technology. So during vaccinations, mobile technologies can be used to track that vaccinators get to these communities that need the vaccine. So when you're able to track that they are getting to the communities that need the vaccines and the people are accepting it, then you leverage on AI. You have technologies like AI, machine learning. AI will help you make better decisions when it comes to planning for your vaccination campaigns, when it comes to the immunization itself, when it also comes to ordering for the quantity of vaccines you need within your community. When you have this, it helps align your data and you'll be able to make a better informed decision. I hope I was able to answer your question. Thank you.
Thank you very much, Mr. Muhammad Faosy. The next question, I'll just throw it to Dr. Sheikh. So someone is asking, and I think it's an interesting question, but I hope you can also answer it briefly. So do we have a vaccine supply gap or simply a distribution gap?
Quite interesting question. Thank you very much.
Interesting.
Well, we do have supply gap as well as the distribution gap because they are also closely linked to each other, or they are the opposite side of the coin actually. So vaccines are costly commodities, and there are resources are not unlimited because most of the traditional vaccines are procured, especially in the case of Nigeria. The resources are not unlimited here. So um, some of the vaccines are provided by some of the development partners, etc. But many of the or most of the traditional vaccines are procured fully by the Nigerian government, federal government of Nigeria. So sometimes we face this, but it's mostly due to the distribution challenges here in Nigeria. Sometimes the national level, the federal level, the doses are quite enough, but sometimes due to multiple reasons, the distribution is interfered or hampered, and then some health facilities may face, or some states or some areas may face a shortage or gap or stockouts. Also, reasons like the coaching capacity, breakdown of production capacity, grid electricity. So that it's a multi-pronged issue actually. Multiple factors are behind that. That's the reason sometimes the facilities
Dr. Sheikh, we're struggling to hear you. We're struggling to hear you. So I think I will just go to the next question. I hope that when I come back to you, your network will be better. So this question, I'll throw this to Dr. Peve, since you're working in the clinical setting. So this person is asking that when organizations are carrying out immunization campaigns, say, we're carrying out a campaign in 36 states of the Federation, is it only recognized health workers that, carry out vaccinations, or do we deploy and train volunteers for assistance? From your experience, Dr. Peve. Can you hear me, Dr. Peve? Mr. Faosy, can you hear me clearly?
Yes, I can hear you.
No, it's not. Yes, I can. Can you hear me?
Okay, I think your network is also a little
Okay,
bit
can I go ahead?
Yes, please.
Can I go ahead from my end?
Yes, please. Please, you can.
Okay, thanks. Vaccination is not only by the recognized healthcare providers, but we also train people within the community to be able to help distribute these vaccinations, and just as to create more receptivity. Like I earlier stated, people are more receptive to people they know in their environments, and also to help with the geographical area of the community. So no, it's not only for the recognized health workers. We normally train and deploy volunteers who would also help with giving these vaccinations, or making sure the vaccinations are available to the people in the community.
All right. And thank you very much. I'm throwing the next question to you, Fauzi, because you'd spoken about vial, I think it was vial wastage, you said. So this person is asking, what can be done when a vaccination provider refuses to administer a vaccine to a single child, citing waste concerns, despite multiple visits? How can I ensure my child receives the measles vaccine when the provider requires multiple children to be present before administering the vaccine? What alternatives are available when a vaccination provider is unwilling to accommodate a single child for vaccination?
I believe it's interesting that you asked that question. Yeah, but there is high tendency that if you deny one person vaccine at the point they need it, there is high tendency they will not return. So what I know has been communicated is to ensure that every child that comes gets vaccinated. And this can be confirmed by Dr. Tevi and Dr. Sheikh too. Once a child is taken to a health facility to be vaccinated, it is the responsibility of the caregiver to ensure that that child gets the vaccine, regardless of the number of children, or else a missed child is also a risk for them, because there's high tendency parents who are involved in other things, they've kept their activity or the things they need to do aside to take the child to that health facility. So if you have the opportunity, seize it and give the child the vaccine he needs. I hope that answers the question.
Thank you very much, Mr. Fauzi, for that answer. I'm putting the next question to Dr. Sheikh. All right. So Dr. Sheikh, this question is from Mr. Samuel Aliu, and he's asking, where does Nigeria currently stand in the implementation of the Gavi full portfolio proposal? Specifically, how do you see the full portfolio addressing critical vaccine gaps? And what immediate priorities should be focused on to accelerate progress towards the 2030 immunization targets?
Thanks, Tejasu. It's quite a technical issue, and this question, I believe, can you hear me? Can you hear me,
Yeah, I can hear you,
Tejasu?
yeah.
Yeah,
Yes,
I
I
don't
can
know
hear
what
you.
happened, what went wrong to my network today. Yeah, I think this question is quite from a person who are engaged in the program planning here in Nigeria. So Samuel, I think um, uh, I guess that you have also been part of this processes in Nigeria. So yes, FPP or full portfolio planning is advancing, and it's quite a long process. Being involved in it, you know that the proposal consists of supports that would come from the Gavi for next 4 years for Nigeria until 2028. And it includes all major activities in regards to immunization, such as MR vaccine introduction, switching to some different presentation which is linked to the minimizing of vaccine wastage. Then the health system strengthening and immunization system strengthening support, the HPV routinization, etc. So uh, the 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 Gavi has approved the Nigerian application, and country is approaching to receiving supports in multiple tranches on a yearly basis or whatever it is. It is yet to be determined, but Gavi and partners and country are working together actually. So the fundamental question is, how is it addressing the vaccination gap? I believe that it would definitely, for the time being, it would help at least to address the gap and help the country towards achieving the immunization goal to immunization agenda 2030 goal. But it is also a paramount that the local investment, local resource channeling would be equally important, and to synergize with the Gavi efforts to really and fully address the vaccine gap. I would rather say. Over.
Thank you very much, Dr. Sheikh. Thank you. I mean, if you look at the Q&A box, you can see some contributions from some of our audience members. Thank you for everyone that is sharing. A quick one, Dr. Peve, quick one. Someone is asking, are there bodies in place to report healthcare providers who show, unprofessionalism?
Please, can you take that question again?
Okay, so someone is asking, are there bodies in place to report healthcare providers when there are cases of unprofessionalism?
Yes, we have incidents reporting in cases like this. Every provider or every organization who goes out to give out vaccines these have supervisors. There's a system always put in place. I'm sure Mr. Muhammed also has this information better than I do, that are put in place to make sure, in case of any unprofessionalism, in case of any difficulties encountered along the line while trying to provide such vaccination or immunization processes, they can be reported, because this is what we take into consideration to further help provide better vaccine.
All right, thank you very much, Dr. Peve. So we have a lot of what you call it, questions. And so what I'm going to do is that we're taking down all the questions both in the Q&A and in the chat box, and we'll appeal to our panelists to look at the questions even after this webinar is closed and provide some answer. Follow us on all our social media channels. We'll put out this questions in a visually aesthetic format, and then you can read the questions and see the answers. And I'd like to announce that we'd like to hear your thoughts on what topic we should dive into next month, right? So you can drop your suggestions in the comment box. Your input is what makes Insights webinar awesome. So for the month of February, we would like to hear what our audience thoughts are on what topic we should dive into next, and we'll give a shout out to the person whose idea we go with. So you can send your idea to our communications email. Can you put that up in the chat box? So an email is going to come in the chat box now. Email address for the communications team of eHealth Africa. So if you have webinar topic ideas, you can send them to that email address. I would like to say a big thank you to Muhammed Faosy-Adeniran, to Dr. Peve, to Dr. Sheikh for being a part of this webinar today, for giving us answers from their expertise. Thank you very much for giving us your time. We appreciate you. Thank you for everyone that tuned in to this edition of Insights webinar. We appreciate you. And this brings us to the end of Insights webinar. Have a great day.